I want to talk to you about one of the modalities that's pretty popular in therapy, or it has been for quite many decades. It's got its place, all right, in usage. It's called the ultrasound, okay, the ultrasound machine. And it's not the same ultrasound you get when you're pregnant and you're trying to see that little baby, that little peanut in there. It is an ultrasound that is absorbed by the tissues, okay? So it kind of works on a similar way as a regular ultrasound for visualizing images, all right? But this doesn't bounce back or refract off the tissues and come back onto the transducer here. That's the transducer to create an image. This goes down and it's absorbed into the tissues. So if you go into therapy and they're like, hey, I want to do an ultrasound on you, don't expect any pictures. And they should also verify that you don't have any implants or different devices that could be counteractive or counterproductive to using an ultrasound, okay? Oftentimes what I'll use ultrasound for, a couple of different reasons. One, to decrease inflammation. Two, to create deep heat. Those sound counteractive though, right? You don't want to add heat to cause inflammation. Well, there's different settings. You can put it on 100% ultrasound, meaning that ultrasound beam is going at 100% of the time. That's going to create heat, okay, a deep heat. Now, if I put it on pulsed setting, I can, do 20%, 50%, some settings are 10%. You can change and make it where it's only, the ultrasound is only going for 20% of the time or 50% of the time. Either way, those do not create heat, okay? It's pulsed. So it's not going to accumulate on that heat setting. Both those settings, though, help increase fluid flow into this area that you're actually doing the ultrasound. You increase fluid flow, well, what's the fluid in our bodies? Blood, lymph, water, okay? Basically, it's trying to create a better atmosphere for healing, all right? And so you can change the settings also to target different depths of tissues, all right? So ultrasound is very versatile on getting to different tissues. One of the biggest limitations on ultrasound is you see this transducer head. The effective area for treatment within a 5-minute period of time is about 2 times the size of that transducer head. So that's the effective treatment area, all right, from here to around there. So it's very small. So if somebody's like, oh, I'm going to ultrasound my back, I got a sore back, I'm going to do that about 5 minutes. You're just working up the bill. You're not getting any effect from that, all right? You want to work that back, you're going to be there for like 30 minutes, all right? So it's a small area, small use, small area for that, but very effective for when you have that area that's needed to have it. So I'm going to give you an example. I'm just going to turn it on here and let you see that it's not scary, okay? And it doesn't cause any muscle spasms or anything like that, but it can create a deep ache. So I get some gel on there because you don't want to leave this out in the air because that'll ruin it. So I'm going to turn it up a little bit, okay, hit on the setting I want, and push start. So if I hold it in one place and I have it on 100%, that heat is going to accumulate in that area and it's going to start heating up the bone tissue underneath. That's not our target, all right? That's not what we want. We don't want to heat up the bone tissue. We want to if we want heat, we want to kind of get that just kind of moved around. And if you have a deep ache, all right, no, don't get afraid. It's okay. We just need to move that ultrasound head around, okay? So basically, this is how we do it. This is where it's at. This is our area that we're going to treat, all right? It's a small area. And now if we want it on a pulse setting, very specific area, then we can turn it on to a pulse setting and just hold it right there. And again, if it's accumulating too much, you'll know it. You'll get a deep ache. It won't be hot or heat. You won't feel that. It'll just be a deep ache. And then you just got to move it around a little bit. Okay? So anyways, that's kind of some of the usages for ultrasound. I think it has its effective area in treatment. It's very relaxing and can feel good. when it's done correctly and applied in the accurate, right format. So don't ever do it on your own. Usually you can buy these, I'm sure, but they're pretty expensive, so you don't want to. So listen to your therapist, talk to your therapist. They should explain all this to you, just as I explained it to you. But that's the purpose and uses of ultrasound. So don't expect pictures, expect results though.